Hello everyone, today we are going to learn about food poisoning that causes by tetrodotoxin in pufferfish. So now we are going to review an article on topic a review of food poisoning caused by local food in Japan, which we are only focusing on tetrodotoxin poisoning. So the first point we are going to discuss, which are the epidemiology. Japan is one of the few countries that eat pufferfish and among the biggest consumers. So most poisoning cases are from Japan. So annually, 30 to 50 casualties including lethal cases are reported. And this number increases from autumn to winter. So as we know, tetrodotoxin is the most common natural marine toxin to cause food poisoning. And it poses a serious hazard to public health. Next, the point is on etiology. The most well-known cause of pufferfish poisoning is tetrodotoxin. However, the fish also carry additional poisons, which is saxitoxin. Furthermore, pufferfish does not directly produce tetrodotoxin. Instead, in the water, Pseudomonas and vibrio produce tetrodotoxin, which subsequently accumulates in the fish ovary or liver. And this toxin is very hazardous to us, because even at low concentration, it may prevent depolarization of voltage-gated sodium channels on the surface of vascular smooth muscles, skeletal muscles, and neurons. Besides, tetrodotoxin, on the other hand, has no effect on cardiac muscles in general. Now we will go to the next point, which is clinical manifestation. It is prohibited to consume pufferfish ovary or liver since it nearly always includes tetrodotoxin. However, in other animals, the ban extends to muscle or skin because those components also contain tetrodotoxin. Next, individuals handling pufferfish must have proper license. And the majority of cases occur at home in those who do not have a license. Hence, it's very crucial to handle the fish because tetrodotoxin cannot be eliminated or inactivated by heating or washing. Now, we will see on the symptoms of tetrodotoxin poisoning. There are 4 degree characteristic symptoms of tetrodotoxin poisonings, and we will go through one by one. The first degree are neuromuscular symptoms, which include paresthesia of lips, tongue, pharynx, taste disturbance, dizziness, headache, diaphoresis, and pupillary constriction. Next, on gastrointestinal symptoms, it causes salivation, hypersalivation, nausea, vomiting, hyperemesis, hematemesis, hypermotility, diarrhea, and abdominal pain. The second degree characteristic causes additional neuromuscular symptoms, which are advanced general paresthesia, paralysis of phalanges, extremities, pupillary dilatation, and reflex changes. For the third degree characteristic, the symptoms are increased neuromuscular symptoms, which are dysarthria, dysphagia, aphasia, lethargy, incoordination ataxia, floating sensation, and also cranial nerve pulses. Next, on cardiovascular or pulmonary symptoms, it includes hypotension or hypertension, vasomotor blockade, cardiac arrhythmias, including sinus bradycardia, acetylcholine, and tachycardia. While on dermatologic symptoms, it includes exfoliative dermatitis, bata GI, and blistering. The fourth degree characteristics are respiratory failure, impaired mental faculties, extreme hypotension, seizures, and loss of deep tendon and spinal. The last point will be the diagnosis and treatment. Clinical reasoning is used to diagnose practically all instances in the absence of commercial testing. And tetrodotoxin identification from patient's urine or blood specimen as well as leftover meals is used to provide a definitive diagnosis, and the symptoms appear quickly between minutes to hours of intake. While paresthesia of the face or around the lips as well as paralysis of extremities are typically clinical symptoms, and some people have respiratory muscular paralysis, which is potentially fatal. Next, because there is no antidote or particular therapy, symptomatic care is the primary. Gastric lavage or activated carbon intake are advised if poisoning is reported within 1 hour of commencement, while for bradycardia or hypotension, extracellular fluid or atropine injection is suggested. And lastly, the artificial ventilation and intubation are utilized in the case of respiratory failure, and the only known remedy is to wait for the poison to be excreted by the patient's body. Now we will see the video on handling pufferfish by professionals. First and foremost, pufferfish handler must have license to handle the pufferfish. The first type of handling this fish is to remove the blood under the running tap water. Next is to remove the fins of the fish. Followed by removal of the skins. This is the flesh of the fish, and it is safe to consume. Furthermore, the soft roe of the fish is not poisonous. We can eat it and it is safely to consume. And lastly is to remove the liver and heart of the fish, which are poisonous and harmful to us. That's all from me, and thank you for watching.